all, welcome to our Triple S series, which is a designed YouTube series which is going to help you for your EBCOG Part 2 exams. I am Dr. Priyadharshini, your course director at Study Medic for Study EBCOG courses. When you believe in yourself, anything is possible. So, wishing you all the best for your exams. We need to remember that one of the most unique skills that you are going to face for your EBCOG Part 2 exam is on complex technical skills. Many of y'all might not have an idea of how exactly the cubicle is going to be like and what you are going to perform in this station. Well, here I have tried an attempt to make you understand and give you a real experience of how a complex technical skill station is going to be like and how you have to approach that particular station. Now, some sample stations that you can face in exam are management of a postpartum hemorrhage. Postpartum hemorrhage, you can be tested on the medical management, you can be tested on the surgical management. Another scenario is eclampsia. It can be a severe preeclampsia with imminent eclampsia, or it can be eclampsia, that is, a woman with seizures. You can have a station on maternal collapse. Well, the causes of maternal collapse can be many. When you have a crisp history, you will have an understanding of what has caused the maternal collapse and you need to act accordingly. Shoulder dystocia, management of shoulder dystocia by applying all your maneuvers can be tested in exams also. Breech delivery, conduct of a breech delivery, or managing the aftercoming head of breech is again a common station that can be tested to assess your complex technical skills. Cord prolapse, how will you diagnose and manage a cord prolapse is again a critical emergency in obstetrics. Inversion of uterus, so diagnosis and management of inversion of uterus. You can also be tested on other emergencies like torsion, a woman presenting with severe acute abdomen where the diagnosis is going to be a torsion of cyst or ovary. You can have a ruptured ectopic with impending collapse, which can be an evolving scenario turning into collapse. Now, the common factor that we see in all these stations are all of them are emergencies. They are acute emergencies in obstetrics and gynecology. So we need to understand that not all tasks can be done by an individual. So we always look out for teamwork and how good you are a team leader, how well you're communicating with your team, and how effectively you're managing this given emergency. That is what is going to be tested in your complex technical skills. So you will have communication with your colleague, communication with the patient, your applied clinical knowledge, where you will be tested on how good you are in managing the scenario and are you using the standard international algorithms for managing the given situation. Are you using the appropriate drugs in appropriate route and doses? Are you using the correct surgical technique? All this will be tested upon here. And also, how effectively you're going to manage the given situation. Following that, are you appreciating your team for all the hard work and effort they have put? Are you noticing the deficits and how well you are going to encourage your team? Are you doing your duty of candor? Are you talking to your patient? Are you debriefing her? Will also be seen in this station. So, when you have a helicopter view of what is going to happen, you might think there are n number of things you need to perform here. Well, basically, you are just going to assign roles and you are just going to be a very good team player in controlling the situation and managing it effectively. So, when you are going to enter the station as a candidate, most importantly, you need to understand where you are, what you are doing, and who are your team. All these are factors that are help you clear the station. Now, how are you going to approach? As I already mentioned, all emergencies are managed as a team. You need to form your team. As soon as you enter the cubicle, you will find many members standing inside, and all of them are going to be new to you. So, you need to introduce yourself, get your team quickly in place to manage the emergency that's been given to you. You need to assign roles, as you can perform only one task, so does your team members too. So every team member is going to be assigned a particular task. And as a good team leader, it is your responsibility to assign tasks and ensure that the tasks are being completed. So always try to have a close communication with them. First thing, you need to make the right diagnosis. Is it a case of postpartum hemorrhage? Is it a case of shoulder dystocia? Tell out the diagnosis to your team. Only if you alert the team with the diagnosis, they are going to help you form the team. And you need to follow the appropriate protocols. You need to follow the steps and the guidelines that is provided. For PPH, you need to understand what is the type of PPH in making the diagnosis, and then you go ahead with the management. Say, for example, atonic PPH, the management is different. If it's going to be because of trauma, the management is going to be different. So you need to work on that also. You need to have a complete control of the situation. It is not expected that you are going to get panicked in the situation, because the minute you get panicked, things go out of place. So you need to understand that it is just like performing a mock drill. So you have a complete control and you are going to do it. Finally, at the end of the station, however panicked you are, however anxious you are, do not forget to thank your team for what all help they have given and the support they have provided to you. And suppose if you see the patient is awake, say for example, it's a shoulder dystocia you manage, you certainly will have to debrief the patient and thank the patient for all the help and cooperation. So all these small points are definitely going to help you in clearing the station. So, some tips and tricks about your complex technical skill. One thing is to practice drills. If you have the opportunity, kindly do practice drills more and more, participate in drills, so you will understand of what exactly you are expected to do. And if a patient or if a dummy is going to be kept there, treat the dummy as the patient. Consider the mannequin as your patient and talk and explain. Second thing, assigning roles. Having a closed loop communication is important. Just giving orders and not knowing whether the orders have been performed or not will lead to failure in your emergencies. So that's the importance of having a loop communication, a very closed loop communication, and understand that the task has been completed. Ask for findings. You need to know the vitals. You need to know the amount of bleeding that's going on. You need to know if the baby is coming out. So ask for findings. Only if asked, the findings will be provided to you. The role players also have a set agenda or a script that they are going to follow. So before you start the station, have a clear picture of what you're going to do there. Most importantly, don't panic. We know it's emergency, and you need to know that you are being tested on how you handle obstetric emergency. So just do not panic inside. Whatever the properties are available, make sure you're using everything. Say for example, you're going in for a shoulder dystocia, just make sure you're wearing the glove that's placed on the table, and then you go ahead with conducting the shoulder dystocia. So these are some important points to remember. So let's go and perform today's station. The candidate instruction that's given here is the emergency buzzer goes in labor room 5. Miss Sheila is a primary gravida. She has just delivered a baby of weight 3.900 kgs. She had an uneventful pregnancy and delivery. Your SHO has called for help as she notices excessive bleeding after the delivery of placenta. You, being the labor ward in charge, is moving towards room 5, and you have 11 minutes for the tasks. So, the candidate instruction, you have 1 minute. In that 1 minute, you hardly have 4 points to read. So, quickly make an agenda of what you are going to do, and you have 11 good minutes to go inside the cubicle to perform. So, reading the candidate instruction, some vital information for me. I am the labor ward in charge. I'm going to room number 5. I've been called by my SHO. We have a woman who's delivered, so third stage of labor complication. In this case, it is excessive bleeding, so it's a case of postpartum hemorrhage. Most probably postpartum hemorrhage. With the relevant information I have, I see a baby of 3.900, which is slightly on the higher side. So I'm thinking causes of atonic PPH and traumatic PPH here. However, I need to go inside to analyze what is the scenario and see where do I stand in the management plan and start my resuscitative efforts for the team. So these are some information that I have, and this is the agenda I have set to manage this. So next, I'm going to enter the cubicle and I'm going to perform the task.
Okay, I've just entered labor room 5, and I've been called by my SHO because she's having bleeding. So, Priya, can you tell me what's happening?
Doctor, she just delivered and she is completely bleeding.
Okay.
Please help me.
Okay, Priya, that's okay. We have pressed the emergency buzzer. So I've got Anusha. She's going to be one of the midwives helping me. I've also got a scribe who I will ask to just start recording the time and the everything that we are doing. Okay, Sheila. Hi, I'm Devina. I'm one of the doctors on the labor ward today. We because you are bleeding really heavily, so that's why there are a few people in the room. They are here for a reason. They are just gonna try and control your bleeding. Okay, if you feel any problems, just keep talking to us about any concerns that you are having. Okay, Sheila. Okay, Priya, would you be able to attach just can you get some observations, pulse, blood pressure, and
Yeah,
oxygen?
yes, her pulse is 82 in the minute, 82 per minute. It's regular. Her BP is 100 by 60 and her saturation is fine.
Okay, and her temperature?
Temperature is normal.
Okay. Anusha, would you be able to secure a wide another cannula for her? I can see she's got one cannula. Can you secure another cannula, white bore one, maybe a green or a gray, and just take some bloods. Just take a full blood count, use an ease CRP, and also send for blood grouping and cross matching. And Send these bloods as urgent, please, and also send clotting studies.
Okay, doctor.
Okay. Priya, would you mind attaching the oxygen for our patient with a face mask?
Yeah, sure. Can you tell me how much of oxygen?
Can you put it on 15 liters, please?
Yes. I have adjusted to 15 liters. She's on oxygen.
Okay. We were Sheila. We're gonna lie you a little bit flatter on the bed, and I'm sorry. This might hurt a little bit. I'm just gonna examine you. Is that okay?
Yes, doctor. Okay, doctor.
Yeah. Okay, Sheila. Okay, so at the same time, what I will do is with sterile gloves, I will start all my examination. I will feel the uterus if it is contracted or not. And In the meantime, I will check. Anush, have you sent the bloods?
Yes, doctor. It's sent.
Yeah, okay. Also, where is the baby, Anusha? Is it okay?
Okay,
Doctor,
ma'am.
the baby is
Yeah.
given to the pediatrician. The baby is doing fine.
Okay. Thank you, Priya. Okay, just keep giving me observations, and I'm just gonna examine so I can see that she's got some small tear and the uterus is boggy. So, Priya, can you what oxytocin we have given her till now?
We have just given her 10 units intramuscular.
Okay. Can you get an infusion set up for me for 40 units of oxytocin at 1 to 5 ml per hour? And
Sure. I
also,
have.
we need 1 gram of tranexamic acid, and we also IV. And we is she allergic to anything?
No, she's not allergic.
Is she hypertensive?
No, she's not a hypertensive.
Not hypertensive, not a negative blood group.
No.
Okay, so then we can consider giving an ergometrin. So Anusha, please go and get some ergometrin for us while Priya can start preparing the oxytocin and the tranexamic acid infusion.
Sure, doctor.
Okay. I'm suspecting tone as to be the major cause of hemorrhage. And Priya, would you be able to go and check the placenta? Was it complete when you delivered it?
Yes, the placenta was complete.
Okay, that's fine. Okay, so
Oxytocin
Anusha,
drip is going on.
sorry.
Oxytocin drip is going on for the patient.
Okay. I'm also starting the bimanual compression. Just to ensure that the tone is maintained. So we will try with the bimanual compression. And Priya, would you please measure the blood loss for me? How much blood loss have we come up to now?
I think it's almost 800 milliliters.
Okay, we need to give her some IV fluids. And so, Anusha, please start her IV fluids, Hartmann solution 1 liter. And also, we have to check for blood, if blood has been sent for cross match. Okay.
Okay, doctor.
Okay. Yeah. So I'm just gonna reassess the situation, and I would need a repeat set of observations. Priya, would you be able to do some observations for me?
Her BP right now is 90/60. Her pulse is 89.
Okay, so we need to give the fluids fast. So we are giving the fluids. I would also like to ask for the anesthetist to be present in case she deteriorates further. We might need to resuscitate her. So Anusha, please go and call the anesthetist if we have not already done.
Okay, doctor.
Yeah. Okay. And how is the bleeding now? Is it settling now?
The bleeding it seems a bit better than prior to.
So we can give her hemobate as well, which is PGF2 alpha. We can give that. We can give up to 8 doses every 15 minutes apart. So I will give the first dose now, and I will ask my scribe to inform me when the 15 minutes are done, so we can assess for the second dose. Okay.
Noted. I started to scribe down.
Yeah, okay, that's fine. We will check if the bleeding is ongoing. We might have to start the major obstetric hemorrhage protocol. We might have to activate it, and we'll have to call the hematologist to guide us about the blood and blood products transfusion. Sheila, may I ask you if you've got any reservations for blood and blood products?
A doctor, as per her notes, there is nothing.
Okay, that's fine. Okay, is she responding? Is she okay?
Yes, yes, she is talking to me. She's doing fine.
Okay, so we will reassess the situation. I will reassess the perineum. If there is any tears, we'll have to repair it as soon as possible, and we will keep her under strict monitoring once the bleeding settles. And I will debrief the woman and debrief my team, um, because this can be a very stressful situation. So I will make sure that everyone is fine. Is there anything else? Any questions, Priya, currently?
No, she is doing fine. She's talking to me. And can you just tell her how the baby is? She just seems a bit worried.
Okay. Okay, Sheila, the baby is with the baby doctor. So what we'll do is I will ask one of my team members to just go and check what's the baby update with the baby. Anusha, would you be able to go and check with the pediatricians?
Yeah,
And if
sure, doctor.
the baby can be brought over back to Sheila.
Sure, doctor.
Okay. And because we've had a postpartum hemorrhage, we need to make sure, Priya, that we have to document everything. So you document the bit about the delivery and the delivery of the placenta, and then we will document everything about the emergency. And Sheila will come tomorrow to tell you a bit more about what has happened, because I know that this is a very, very stressful situation. I will also talk to the partner to tell him about what has happened, and there is a high chance of bleeding happening again in the after the next delivery. So we need to make sure that we document everything properly. We'll also repeat all her blood parameters in around 6 hours, and then assess if there is any need for iron transfusion or blood transfusion, depending on that. And if it's a major pph, if it's more than 1500 ml, then we have to do an incident report, and we have to make sure we document and reflect on the incident. Is that okay?
Okay, doctor, I've noted down all your points.
Okay, Priya. Okay, so I will after the incident is done, we'll all have a cup of tea and calm down in the handover room.
Thank you, doctor. Thank you for helping us in this situation.
Okay, no problems.
So, welcome back. I hope you guys have enjoyed the short video on how a complex technical skill has to be managed. Now, let us look into the marking system. Marking system, most importantly, it will be divided. It's not completely on how your technical skills are. It will be divided into your technical skills, your communications, and so many factors. Now, first looking at the technical skills. This station was on postpartum hemorrhage. The first thing you do is to make the diagnosis of postpartum hemorrhage and tell it to your team. We are handling a case of postpartum hemorrhage. That's going to give you the first mark. Okay. Second thing you need to remember, the baby is also there. So the baby has to be handed over properly to the neonatologist and make sure the baby is being taken care of. Next, you're going to communicate with all your team members, assess the patient, and resuscitative measures must start immediately. The women must be on continuous monitoring. You need to understand that the woman has just delivered the baby and she will not have any clue why so many people are entering the room. So you tell the women that do not panic. We are all here to help you. We just see a bit of extra bleeding, and I am the senior in charge of the labor ward today. So I'm here to just help you. Hope you're doing fine and congrats on your baby. Just give us some time to assess the situation and help you. Tell her thank you for that, and then you go do a quick examination. You look at the uterus, see if it's contracted or no, and then you ask the SHOs, conductor of the delivery, or the midwife who's around, ask her for the amount of bleeding so that you will have an idea about the degree of postpartum hemorrhage. You start with palpating the uterus, make sure the uterus is getting rubbed up well and is getting contracted. Your position, if you want to stand in the foot end of the patient, you have to mention that I'm going to stand in the foot end of the patient and I'm going to take control of the bleeding. Meantime, I'm giving you roles. Okay, call in the assistant, call in the anesthetist, call in the blood bank, make sure the amount we have enough blood for transfusion. Then you'll assign the midwife. You I want you to take in bloods, and you have to mention for what specifically you want the bloods for. Okay, give the Foley's catheter, insert it into the bladder, and connect it to the bag. Okay, the hemodynamic status of the women is very, very vital, so you need to have a control over that. You give her oxygen and you give her oxytocin. Now when you're giving drugs, you will have to make sure you're following the correct order. You have to rule out allergy whenever you're giving drugs to her. Methyl ergometrin is very, very important drug in management of PPH. However, allergy has to be ruled out. You need to ask for examination findings in between, because without examination findings, you don't know towards what direction you're going to. Whether the postpartum hemorrhage is being controlled or no, you will have no clue at all. If the woman is still bleeding despite you giving all the oxytocics in order, that means it's time for you to shift her to the theater. You can talk about the mechanical methods. If you have a mechanical balloon that is kept like Bakri balloon, then you need to take it and apply it. You might not have time in the 11 minutes, but at least have a mention about that. Do you have the Bakri balloon? Can I use it? Let me try if I can do a compression to control the bleeding. And suppose if you are being tested on surgical methods, then definitely you have to demonstrate your B-Lynch, and you will have a uterus model to demonstrate that. So whenever you're demonstrating any surgical techniques, most importantly, you will be tested on how whether you're applying your B-Lynch in the correct points, how are you handling your needles, and whether you're guarding your needle. So these are some minor things that you will have to be very careful whenever you're using any needle in your exams. Coming to teamwork skills. Now, what is this teamwork skill basically about? It is about how you're forming your team, how you're communicating the team, and whether you are appreciating your team for all that they have done for you. You need to ask for help, assign tasks to individual team members, have very good leadership skills, appreciate them for what they are doing, and you give them a very, very positive feedback at the end, because as you are stressed, so are your team members. So appreciate everybody's help into this. Communication skills. Communication is both with your role players, that is your mannequin who's there lying down as a patient, and also to everybody who's helping you there. You need to give proper instructions. Give oxygen is an instruction. Give oxygen 2 liters by mask is an instruction. So which of the instruction is more clear? Of course, the second one, how much amount of oxygen, what is the route of administration, you have to tell them very clearly. And most importantly, whenever you're talking about any drug, you need to make sure, is the patient allergic to it? Is there any contraindication? If your SHO is going to say no, then you say, okay, give her 10 units of oxytocin intramuscular route. Okay, this is going to be the method you're going to tell her. Okay, it should be very, very clear and relevant information. Second thing, you need to be very sensitive and you must have a systematic approach to the situation. You're not supposed to jumble everything together. Use non medical jargon in this. Finally, the role player. If the role player here are going to be multiple people, so they are going to assess you, how professional were you. Are you going to shout at them for not doing a task? Are you trustworthy? Are you having a control over the situation? So they are definitely going to assess you of how good a team leader you are you listening to them. It's not always just because you being the team leader you're going to be right. Sometimes the SHO or even the junior most member in your team might notice something which is very, very valuable for you to maintain the situation. So that is important. Say for example, you're managing a PPH and suddenly you're seeing that the cannula has come out and she's bleeding. So obviously the drugs are not going in appropriately. So if this is noticed by your junior and told to you, are you appreciating that? So all these will be taken into account. And how satisfied the role players feel about you. Have you given them a feedback about what has happened? If they are not performing well, have you given them options like conducting more drills to cope up with the skills? All this will be taken into uh, your marking scheme. Finally, the global impression of how you had handled the situation will be taken into account before giving you a sure pass or no in the station. And I'm very sure that all of you all are going to do very well in this complex technical skill station. One mantra that you have to follow is to stay calm and stay professional, and this station is going to be all yours. So we have more than 1 lakh people following us, and you are going to join us soon. And thank you for all the trust you have with us from Team Study Medic. I would like to thank every one of you and also wish you all the very best for your exams. Subscribe and watch us, follow us for more videos and updates for everything happening in the field of obstetrics and gynecology. Thank you so much.